Parul write lessons to raise awareness on tuberculosis, COVID, and tobacco use. TB, as we all know and aware, is one of the most infectious diseases that India is facing today, and it carries the burden of nearly a third of TB cases reported globally. The theme of World TB Day 2022 is Invest to End TB, Save Lives, and this conveys the urgent need to invest resources to ramp up the fight against TB and achieve the commitments to end TB made by global leaders. This is especially more important in the light of COVID-19 epidemic, which has halted years of progress in the fight against tuberculosis. The discussion today would primarily have four key aspects: applying learnings from COVID-19 in communication for TB control, TB tobacco interlinkages, COVID TB infection, and the role of multi-stakeholder partnerships to end TB by 2025. The session would also witness a keynote address, as Parul mentioned, by Sri Rajendra P. Joshi, Deputy Director General, Central TB Division from Ministry of Health and Family Welfare. And we also have a great lineup of speakers today, and taking this opportunity to introduce them to all of you. We have with us Professor Amir Ullah Khan, who is the Research Director, CDPP and Adjunct Faculty at ISB. LM Singh, MD, from Vital Strategies India. Neelam Makhijani, Country Director from Child Fund India. Dr. Rachna Acharya, Associate Director, IDV and Global Public Health India from Janssen. Shibu Vijayan, Global TB Technical Director from PATH. And Vaishakhi Malik, Associate Director, South Asia, Policy and Advocacy Communications, Vital Strategies. The session will be moderated by Parul Chand, Editor-in-Chief of PR Movement India. And I would now request Parul to take forward the session's proceedings. Over to you, Parul.
Yes. Before we begin, I'd like to request Mr. Singh, sir, to please introduce the keynote speaker before we play the address. Over to you, sir.
I hope I'm audible.
Yes, you are, sir, now.
Okay, well, thank you very much, Parul and Shamishta, for that introduction to all the session speakers. And thank you for inviting me over, and thank you for organizing this on a very important subject, which, as you rightly said, has got somehow buried with COVID and all the other priorities we've been having in the country. And my warm greetings to all the panelists, attendees here today. And I'm quite delighted to be a part of this podcast. Considering that we're just getting out of COVID, and this important subject of TB again is getting that attention which it deserves. And more importantly, the interlinkages which it has with tobacco. I don't think it can be emphasized enough the kind of havoc COVID played both on our health systems, our lives, and it really brought to center stage the importance of good health and its interrelation to economic well-being. I believe more than millions of jobs were lost in our country. Close to billions of dollars of economic loss happened. And as you rightly said, the most impacted were the marginalized people. So I think one thing which the pandemic clearly demonstrated was the need for stronger public healthcare systems, both in India and globally, and the need for greater cooperation between different stakeholders, be it the government, the different departments, the research, which actually enables a lot of good work to come out of it, the academia, the civil society, the private sector. And not the least, the innovators and the people who are actually sort of pushing the envelope for better solutions. In light of all this and before, Vital Strategies has been reimagining public health systems as we go into the next decade. And we've been looking at seeing how these challenges can be addressed. And I think there is a need to recognize that public health is for everyone. It is not really for the rich or the poor, but it has to cover a collective and an effort which actually aligns and enables all of them to get access to good healthcare. This really brings my focus on two major public health challenges which we're talking about today: tuberculosis and tobacco. Both TB and tobacco independently cause considerable health and economic burden in India. And we all know that the profound socio-economic implications. You don't need to go far. If you look around, you'll see its usage of tobacco and the incidence of TB in the poor and vulnerable, and how deeply they're impacted. I believe, as the statistics sort of highlighted, that of the 2.6 or 3 million odd cases in India, 46% of those TB patients actually also have consumption of tobacco as a part of the lifestyle. And of this, there were 90% who were actually males. So clearly, the interlinkages between tobacco and TB cannot be overestimated. We need to understand that unless we tackle these two together, we perhaps may not be able to meet our goals of end TB in the timeline our Honorable Prime Minister set for us. I think studies have also shown a very important aspect of this particular disease and its impact, particularly on the young. They estimate that the most the highest level of death and the most impacted are people in the age group of 30 to 69, and that's really the highest, if I can say, at the peak of your economic earning life cycle. So clearly, the economic loss which it causes to the people and to the country is again huge loss both of life and of the economic potential which these people have. So I think the question today for us is that post this pandemic, how do we really align our efforts and how do we ensure that all of us can come together and whether it's the policymakers, the people who make investments from the government, the private sector, how can we really align ourselves to end this particular, or rather move towards ending this particular disease? And clearly, the ban to tobacco has its promotion and its continuation. Vital Strategies has been working with the government of India around the tobacco control, policy promotion, and communication programs. And we recognize the importance of messaging and creation of awareness, dissemination of accurate information, and for improving behavior among all stakeholders, particularly the poor and the vulnerable. Our work in the public health has included in the areas of tobacco control, making the connection between tobacco use and its disastrous health harms, supporting policy goals such as smoke-free environments, tobacco tax increase, and so on. Our global advocacy work again has led to the inclusion of the WHO Framework Convention on Tobacco Control in the United Nations Sustainable Development Goals. So coming to the theme of today, which is the World TB Days, Invest to End TB, Save Lives. I think as COVID has taught us this lesson that we cannot really underestimate both the social and the economic impact a disease has. So I'm glad to see that we've interlinked the World TB Day with the need to make that investment, whether it's the investment of awareness, investment of our time, and clearly the investment of financial money, which can actually help us to meet these goals. Some studies have estimated that preventing any epidemic, and if you look at it from an economic loss of life, would require billions of dollars, $4 to $5 billion a year. And if we look at TB itself within India and look at the disease burden we carry, clearly the amount of investment required and the kind of innovation required, needs to be stepped up and recognized as a big stakeholder, whether it comes from the private sector, the government, or the innovators. So today, I also believe that innovative financing mechanisms are available to effectively address and attract large pools of capital, of private capital with a small catalytic grant. For example, a small amount of money which can de-risk a larger amount of capital can actually lead to efforts towards innovation, towards attracting new investors. And not only that, to bring in operating and financial efficiency in our health system. So I hope we can see that the value investing in healthcare becomes center stage, and the contribution it can have can come from all stakeholders, including our government programs. So at Vital Strategies, we see a vision where every person is protected by a strong public health system. Clearly, the need for every person to be protected is paramount. And global learnings can also accelerate our local solutions. We've got to recognize we live in an interconnected world. So if there is a solution somewhere which can work and can be brought to a local environment, I think it's absolutely relevant. We work with the government in a broad areas of, with the government in India, with the Central TB Division. And I think we would be delighted and would want to see our role to be able to accelerate the government's goals of NTB and to attract more investment into this. And now to share more about the Government of India's efforts towards tackling TB, it's my great pleasure and honor to introduce Dr. Rajinder Prasad Joshi ji, Deputy Director General, Central TB Division, Ministry of Health and Welfare. He will be speaking to us today to deliver the keynote and share his thoughts on this important subject. Vital Strategies has been a long-standing relationship with the Ministry of Health and Family Welfare, including the Central TB Division for TB tobacco integration programs. We hope to play our part in strengthening the government's efforts in this important area of work. I hope that the conversations today will carry out much into the larger dialogue that continues in various other public spaces. So over to you, Dr. Doshi, and I hope we can all draw some learning which can actually help us to accelerate our goals. Thank you.
We can't hear Dr. Joshi.
Sorry, I've just.
Good afternoon, everybody.
Is it clear now?
I'm very happy to be part of this podcast, and I thank the organizers for giving me the opportunity to be a speaker in this very important session. Every year, we celebrate the World TB Day. World TB Day is celebrated on 24th March. This was a
Sorry, I'll just. Apologies, I'm just playing it again. It basically switched to the headphone.
Good afternoon, everybody. I'm very happy to be part of this podcast, and I thank the organizers for giving me the opportunity to be a speaker in this very important session. Every year, we celebrate the World TB Day. World TB Day is celebrated on 24th March. This was a day when the Robert Koch announced to the world about the discovery of the Mycobacterium tuberculosis. And this is a day where we want to refocus the world's attention towards this very, very important topic of tuberculosis. And this year's theme is invest to end tuberculosis and save lives. This is a very apt theme because tuberculosis is one of the major infectious diseases which is affecting the mankind. And even though it is one of the very old diseases, and even though we have got a lot of very good ways to diagnose it, treat it, and even cure it, it remains a major public health problem across the globe, especially in countries like India. So the world, taking cognizance of this fact, announced the Sustainable Development Goals where they wanted to eliminate the tuberculosis by 2030. In India, we have got an ambitious goal of eliminating tuberculosis by 2025, 5 years ahead of the SDG goals. And we are all striving hard, and we require the help, support, and guidance of all people across the community, across the different stakeholders to achieve this very, very achievable but very important goal. Investment in tuberculosis makes economic sense also because tuberculosis affects the people in productive age group, which not only affects the person, but it also affects their organization and the family. And there are studies which say that investment in tuberculosis gives very good returns, even for the corporate people to achieve the investment in tuberculosis gives very good returns, even from the economic point of view. I'm very happy to announce that in India, we have got a strong political will, strong administrative will, and support from multiple sectors, multiple stakeholders who are all working towards achieving this goal. The government of India has got a national strategic plan, NSP, where we have laid out the steps we want to strategize and achieve the goal of elimination of tuberculosis. And we are trying to involve all stakeholders, whether it is other ministries, corporates, private practitioners, communities, community leaders. Each and everyone has to be included because this is a task which can be achieved only with collaboration and participation of everyone. Coming to tuberculosis and tobacco linkage. Tobacco is another major public health problem, and unfortunately, the tobacco use makes the person more vulnerable to infection with tuberculosis, and not only makes the infection more vulnerable, it also affects the treatment adherence and outcomes. Even death rate has found to be significantly increased in tuberculosis patients who are tobacco users. So it is Government of India has got many initiatives to control the tobacco, and we have to create awareness among the community about the tobacco cessation in any form, not just smoking, but other forms of use of tobacco also has to be curtailed and controlled. Then we, from NTEP, National Tuberculosis Elimination Program, we have got in our software, we have used multiple factors to see the susceptibility and how they are affecting, what are the risk factors, and tobacco has already been included as one of the risk factors, and we are monitoring how it affects and what can be done to mitigate it. Last 2 years have been challenging for all of us because of the COVID pandemic. And we observed that COVID and tuberculosis, they are affecting each other in a negative way. So we have developed a white paper on it, and there are studies have been done to, and which brought out the fact that the mortality and morbidity are very high when there is a association between tuberculosis and COVID. Tuberculosis patients are more susceptible to develop COVID infection and severe infection, COVID infection, and patients after COVID infection, they are more susceptible to develop tuberculosis or reactivation of the old tuberculosis. Hence, we have started bi-directional screening for tuberculosis and COVID, which has found to be quite effective. This is a period when all of us have to work together, join together, and contribute to eliminate tuberculosis. Each person can contribute, whether it is a public health expert, clinician, or a person who is in some other field. Because awareness about tuberculosis is unfortunately not up to the mark. Even though we are in an information age, the awareness about symptoms of tuberculosis, which are very simple, like cough more than 2 weeks, blood in the sputum, weight loss, mild fever, night sweats, loss of appetite. These things are very easy, but unfortunately, there are many people who don't link it to tuberculosis, who don't seek the facility of health, whether it is private or government. So unless the health seeking behavior is improved, we cannot achieve the goal of elimination. Another factor is treatment adherence. Tuberculosis is eminently treatable and cure rates are very good. We have got very good medicines which are spread free of cost through Government of India. But unfortunately, many people do not take the treatment correctly. And if they stop the medicine in between, not only they suffer, but they may also develop drug-resistant tuberculosis, which requires much more aggressive treatment, different type of treatment. And they're near and dear ones. Hence, every person has to learn about tuberculosis, learn about the scientific aspect of tuberculosis, and try to spread it in wherever he is working, whether it is a working place or whether it is his community. Everyone can contribute and should contribute. Another thing about tuberculosis is the stigma. Even though tuberculosis is a very old disease, still in many parts of the community, there are stigma associated with it. People are afraid to reveal it to their employers. People are afraid to reveal it to their relatives, friends, because of the stigma associated with tuberculosis. So this also actively, we want the help of all persons to mitigate this so that the tuberculosis patient, which scientifically he is not a risk to others, but he should be able to lead a normal life without any fear or stigma. We have got such a good medicines that even though a person has got active tuberculosis, once they start the treatment, very rapidly they become non-infectious to others. So there is no reason for a person to hide it. there is no reason for them to suffer mentally, socially. So again, here I request all the people who are participating in this podcast to help us by learning about tuberculosis. You can visit our website, TBC India, or any other good source. Learn about tuberculosis, and wherever you are, please spread the awareness about the scientific aspects. Spread the awareness about the facilities available for a tuberculosis patient, so that all of us can join together to eliminate tuberculosis. So with these few words, I again thank the organizers for giving this opportunity, and I thank all the people who are participating in podcast. TB harega, desh jeetega. Namaste.
So thank you. I think that was a very pertinent speech by Dr. Joshi. And I think the 2 points which really stood out for me is how he emphasized that it's a very simple communication which needs to be done. The messaging is very simple. And the bi-directional scanning of COVID and TB, which is already on. So that is something which at the communication level also perhaps needs to be looked at. So we're going to now start the entire panel discussion, and the panel discussion will equally look at the communication strategies as well as the key health challenges of fighting TB, funding for TB, as well as looking at cross-program integration for communication. I'd like to first bring the questions up for Rachna first. I'll go to each panelist turn by turn and ask one question, and then we'll come back to the discussion. Rachna, given the kind of work that you do, what would you say are the benefits of horizontal communication for awareness, given the fact that, as Dr. Joshi also pointed out, the common link of immunity, how what he mentioned, it's almost like what we saw with tuberculosis and HIV. So given that, what do you think would be the benefits of horizontal communication strategies?
Thanks, Parul. I think very relevant, very important. And I would start with saying that, yes, it's critical. We understand. Maybe our perspective or would be good to start from a vision of saying that the communication is meant for whom? The communication at the end of the day is meant for a human being, a person, a patient, or a consumer. And if he is at the center, it doesn't matter which disease and which organ we are talking about, right? And that's the core of horizontal communication when you start thinking around whether it's intersection at diseases or intersection within departments or intersection at the same level in districts, right? This could start from a granular level and scale up in different formats. And clearly, if I have to call out some of the top benefits of horizontal communication, I think any communication which integrates this is better in terms of the responsiveness to the user whom you are targeting to. It has an amplifying impact. It brings a very nuanced innovation by itself, which may not be there at the start of your strategy, because there is insights which get generated with an sampling effect. And I think most importantly, it just helps for a very rapid diffusion of knowledge, especially if your communication is related to awareness. And that in turn then gets translated into better adoption, leveraging and optimizing resources. I think these would be some of the top, I would say, benefits which come out on a communication. And we have seen this in multiple programs which have been laid out where integrated communication has worked, right?
Rachna, how difficult do you think, how much of a challenge do you think it is to bring this to COVID and tuberculosis? How much do you think it will be quite a challenge at this point in time?
So I don't think so. It's a challenge because we have seen the success of communication in managing COVID. If a pandemic like COVID could be managed, we just have to take, so COVID has brought a lot of bad things, but we all know it has brought us a huge amount of learnings, right? And if we could take those learnings, and we also need to understand that this can't happen by one organization, one individual, one sector, because everyone brings those strengths. So if we have to, a powerful communication would be possible if we bring different sectoral strengths to really amplify it and integrate it in the system where we want to create that impact.
Thank you so much, Rashna. I'm going to circle back to you with more questions. I'd like to take the questions to Vaishakhi, and then I'll come to Amir about the economic impact of diseases. First to Vaishakhi. Vaishakhi, what are some of the new ways that the linkage between TB and tobacco can be brought out? It's like Mr. Singh also mentioned, attention has gone away from these issues. COVID has become like a major driver of how information is filtered. Given these issues and challenges, what do you think are some of the new media tools that could be possibly used to encourage awareness?
Thank you, Parul, for that question, and good afternoon to the audience and to all my panelists. So coming to the question of interlinkages, so I'm going to talk about the interlinkage between TB and tobacco because that's the area where Vital Strategies is much focused on. A lot of our work, and since past 2 decades, we have been working with the Ministry of Health in strengthening government systems for tobacco control, which is the National Tobacco Control Program. And we have seen that it's not a news to us that first of all, India accounts for the highest number of TB cases. And then when you look at tobacco, we are the second largest consumer of tobacco globally. And the data shows that with 35% adults in India being tobacco users, a significant contributor to TB deaths as well. So what we are looking at is integrating these 2 programs, these 2 epidemics, and controlling them. And to achieve the end TB goals, I think we need to simultaneously also address tobacco use in our country. So that's the basis that we're looking at. And we have also seen that within the government we have the National Tobacco Control Program, and then we have the National Tuberculosis Elimination Program. So the government has also recognized, and as Dr. Joshi also said, they recognize the need, the linkages between tobacco and TB. So these 2 programs, efforts have been strengthened to integrate these 2 programs. So I think there are communication strategies and evidence-based communication strategies that we have been implementing, and we have been helping the government to implement tobacco control campaigns, which are mostly mass media campaigns. And we advocate for mass media campaigns because because they have the highest impact and reach, and that's the evidence that shows. And then there are other strategies like digital media, which can be used as amplification strategies. So what I'm trying to say is that the lessons that you learn from one program, those could be applied to tuberculosis program. But what is important is also to integrate the various initiatives, and COVID pandemic has it has shown us clearly that we cannot look at public health in isolation, the different public health issues in isolation. So integrating tobacco control efforts into the TB control strategies at policy level, implementation, reporting levels. So that is the move in the right direction. And then there are quitline numbers, the national quitline number, which is housed under National Tobacco Control Program. I think we need to look at also integrating the cessation programs within the TB and HIV clinics, and kind of do that cross promotion of these services which are available. So as we said that a lot of tobacco users also have suffered TB deaths. So a simple way to do is through TB screening, also link them up with these cessation programs, which are very successfully led by Ministry of Health and WHO's M cessation program. And lastly, I would like to say that for this integration, we need robust messaging. A lot has not been done when it comes to TB and tobacco messaging. We have done some work in the recent years. Ministry has been doing it, but still there's a long way to go to highlight the link between tobacco use and TB through mass media campaigns.
Okay, thank you, Vishali. In fact, I've seen for myself how when they strongly began to link the lessons with HIV control and TB control, the kind of impact that they had, and especially in highlighting the fact that those with HIV were more likely to develop MDR and XDR, TB, and XDR, as we all know, is fatal most of the time. So thank you for, and I'll come back to you with more questions. I'd like to go over to Amir now. Amir, you as a health economist, that's a very interesting area you specialize in. What is your opinion about the economic impact of COVID and TB? Some of it perhaps is obvious, but I remember interviewing Professor Jeffrey Sachs a long time ago, and he said that it can shave off, TB can shave off at least 1% from a GDP, which is massive, absolutely massive, the economic impact. Over to you. What is your opinion on how the economic burden will play out?
Thanks so much, Parul. Thanks also for the direct question. So, while it is early days and, we haven't yet done the calculations on what the impact has been, there are enough studies and enough models that tell us how devastating the impact of COVID has been on the economy. In fact, even beyond the econometric exercises, the impact is clearly seen by almost everyone. The core sectors that we rely on as the major indicators of GDP growth have all but collapsed. Tourism, construction, leisure goods, travel, all those industries have seen such debilitating impact of COVID that it is going to take a long time to recover. What is important to note is that the economic cost of COVID is not too different from what we saw when we were calculating the economic impact of tuberculosis. And a lot of lessons that we learned doing the tuberculosis calculations were what we used to study COVID, especially because, and here is the interesting thing that often happens, and something that we ought to worry about and look out for, which is what some of you have already spoken about and written. It is what happens when the focus shifts. So when the focus shifted from TB to COVID, then the impact of that shift on TB and TB patients and heightened mortality and morbidity was something that we missed out on, and that is significant. That is more than significant. The fact that we won't be able to achieve our TB targets by 2030 itself means that we are talking about a few $1 trillion worth of economic impact alone on TB. Now, if you multiply that and look at the 120 odd countries that are suffering from TB and now from COVID, then you realize that the economic impact of COVID is going to be very significant. It already has. Look at our GDP growth rate. In India's case, the GDP growth rate is tottering at 4.5%. And that and the impact is needs to be looked at not just from the falling GDP growth rate, but what a lowered growth rate has on employment. It is no wonder that we are also at a situation where our unemployment is at its highest, particularly the educated unemployment. So apart from the numbers that all of you are hearing, when you look at the number of people who are now chronically hungry, number of people who have dropped out of school, that impact, when you add to the overall, the pure impact on livelihoods becomes manifold. And therefore, in this exercise that we are talking about, it is very important for us, and it's great that this session is focusing on the economic impact, because that is what tells you in sheer measurable terms, in very simple units of rupees and dollars, what kind of a deleterious concern we are staring at. And therefore, the more we do to combat this, the better it is. And the sooner we do it, the better. the last sentence that I would like to say is that the reason it's important to look at the economic impact is that it is the economic impact and the numbers that suggests to us the urgency of the situation. Otherwise, one can get lackadaisical and lazy, saying that, okay, so the numbers are down, Omicron is gone, let's worry about something else. But when you look at the economic impact, then you realize that there is a big cost-benefit analysis that we are missing out on. That's why the importance of these numbers. Thank you, Paul.
I have one more question for you before I request Neelam to come in. Are we looking at a possible generational impact of poverty? Are we looking at that kind of?
Super question, Parul. The answer is yes. And the reason I give you a clear yes as an answer is not so much because we have studied what the impact is going to be now, but because we have precedents to help us do that. The most famous case that is talked about is the impact of World War II on Dutch pregnant mothers. We saw in 1949 the kind of impact that the World War II had. That impact, it was very, very well studied. It's a great case study. And we saw how that impacted the health of not only the children who were in the wombs at that time, but their children too. And that resulted in some of the most wonderful estimates and studies done to show how one event like that can have an intergenerational impact. Exactly the same case with COVID. Just to make it even more explicit, you see, one of the things that we saw during wave 1 and wave 2 was when we shut down everything. We had the most draconian lockdown that we saw anywhere in the world, and one of the repercussions of that was that we closed down all our medical centers, the antenatal help, and you had pregnant women not availing of antenatal facilities, of iron infusion and whatever. And you can see that those 12 million or so children that would have been born during that time must have been impacted by the lack of care because hospitals were shut down. So yes, the answer is unambiguous. It is going to be a very serious intergenerational impact.
Thank you, Amir. That indeed, it's a serious reminder of why tuberculosis is not found in coughing mothers in old Bollywood films. It's here and now, and an extremely serious issue. I'd like to go over to Neelam now. Neelam, my question, for you is about the health-seeking behavior post COVID. What kind of health-seeking behavior do you think can happen? And is it too early for children to be exposed to that kind of behavior?
Thank you, Parul, and hello, everyone. Good afternoon. So good question, Parul. I was just telling my colleague this morning, I was in Rajasthan last week, where my brother-in-law heads a hospital and is running the whole vaccination drive. And now that the vaccine for children is out, there was no traction for it, very little traction. So I actually asked him why is it that the children aren't coming forward and the parents are not coming forward. He says, "Dar nikal gaya hai." So
Yes.
so there is we also get into this whole frenzy when there's a wave, and then we all want to rush and get it. So he said, "Ab log dar nahi rahe." So I think dar to hona bhi nahi chahiye, and I don't think these are issues that can be handled by fear or pressure. So in the last 2 years, what we learned was health is important. And we are in a rat race, all of us in our lives, and I think we do take it for granted. So how do we inculcate better habits for better health? I think it has brought that to the surface, which I think is a benefit I would see from this whole experience of 2 years of COVID, that we started to reflect more, we started to dedicate more time for ourselves and our health and for our children. So, I think that's a good thing that's happened. But again, how do you sustain things like that? That I think is a challenge. So it's not easy to always, stay into this very comfort zone or a safe zone, rather. So I think with children, schools are opening up, which is a very big necessity. But then how do you sustain habits that will keep us in good shape and health? We'll decide, we will see this as we get into the fourth wave or the fifth wave. And in this morning's paper said fourth wave may be due by August, but I don't see people reacting like we reacted in the beginning. And I think, one, we are more resilient. I think we have built some resilience in our own systems and in our whole, lifestyle to better address what we, had we been more prepared in the initial stages, we probably may not have suffered as much, and many people lost dear and near ones. So I think it is an important aspect. Children must, we must as parents, I think, and Child Fund that works with very vulnerable communities, I think it is really important for Child Fund to ensure that the programs we run in the vulnerable communities and that the children feel more supported, more aware. And it's not just about, I think also the pressures we put on children, Parul, sirf padhna hai aur marks lana hai. I think all of that whole lifestyle and our, in how we engage our children with extracurricular activities, how we engage them with positive conversations, all that is going to add to there. So it's not just food or medicine, but I think this whole change of the whole agility and the dynamics and how we bring up our children has to also look at. To be changed.
Yes, Neelam, I have one more question for you before I bring in Shibu. It's about the funding instruments. I mean, the funding of TB is a focus area this year. But funding of TB has always been a challenge. You have the GFATM example before us, where the countries are yet to fulfill their commitments, the G7 countries. Given that kind of background, what is your opinion on some innovative funding models like development impact bonds or pay for performance instruments?
So, Child Fund, I think, is the first international NGO that actually has the experience of doing impact bond, pay for performance impact bond. And this is our fourth year that we are doing it. And I think we are the first ones to have experimented it. And especially, and it's more relevant for our conversation this afternoon because it's on TB and nutrition. So the first impact bond that we launched, and it's the first one in the world, is TB and nutrition. And LM, who is on the panel today, he was very instrumental in helping us design that impact bond with PEHEL. So you see, again, taking a step back on this one, innovative financing is very important because as NGOs, I think, we have those very traditional way of getting grants and we still need them. But I think where is it that we see the change and it's a leapfrog strategy in terms of getting paid only when you show the change and show the impact. So how as NGOs, we will be more conscious that we have to give results to get paid. Plus, how do we therefore ensure that we have very robust measurement systems in place? And it raises your accountability standards to the highest. Because, no NGO can lose money. No NGO can actually do something and say, okay, I don't need the money in return. So that isn't a feasible option for us as nonprofits. For us, it is really important that we make the change that we promise and show the change. So these innovative financing is exactly in that line. And Child Fund, and as the country director for Child Fund, actually I raised my hand only because I wanted to push ourselves as an NGO, as a non-profit, that we are also about targets. We're also about showing impact. We are about demonstrating accountability and transparency on how we do our jobs and how do we actually show the benefits in the community. So I believe innovative financing is very important, not to say that the traditional methods are not, but this is really important if we want to really change the world. There's been billions that go into countries and billions of dollars have been spent in India and elsewhere. And the reason I think we haven't seen the change as much as the money has been flown into is because we are relaxed about how and how much do we achieve. There is no, obviously, when in an impact bond, you are penalized if you don't achieve the minimum threshold. So I believe that we need to up our game in terms of showing the impact. So I'm much in favor. So the impact bond that we did with USAID and PEHEL under the PEHEL program with IP was on, we worked with 1,000 patients, for example, in Madhya Pradesh, where TB prevalence is the highest. And we took 1,000 patients. We worked with WHO as part of the consultation. And it was, how do you, like Dr. Joshi was saying, dawai beech mein band nahi kar sakte. And that was exactly the challenge we were seeing in the field, that people would take medicine for a month or two and then migrate. And poverty, of course, is the root cause of everything in those areas. We made sure the patient took medicine for the full 6 months. We gave them immense amount of counseling and home visits, and this is all during the COVID. And we gave them additional nutrition, which is protein-led, high on protein, which therefore helps the medicine to actually, give the benefit to the human body. And we were able to show, we achieved nearly 80%, and it was an impact bond, and we did 80%. And USA then repeated the second round, and we are doing another 1,200 patients. And now the government has looked at our model and asked us to apply for the government to do 15,000 patients with the government of Madhya Pradesh. So actually, you see, we've got a model that now can be replicated across the country. They've asked us to develop an SOP, and USAID has brought in an academic institution in the middle, PGIMR, who is actually doing a third-party evaluation. And all of this is part of the NTB by 2025, because we are working with the government portal, the Nixshare portal, where every patient's detail is uploaded onto the government portal. Third-party evaluation, I think these are all best practices, and I'm definitely for it. And corporates who want to see exactly how their money is spent and shows the difference that it makes, and institutions, I think this is a really good way to do it. And I'm really proud that my team could deliver on it in spite of COVID and so many other challenges, but we did not let our patients down at all.
I think that's really interesting. I remember when GFATM was first launched in the early 2000s, a lot of countries were very upset about the clause that you'll only get the next phase of money after verification by Pricewaterhouse. And there were incidents even in India where the money was not renewed for the next phase because the uptake was not proper. It's very interesting to note from there to today in the last 20 years. It's a fascinating ride to see that. Just one last question about nutrition before I go off to Shibu. Neelam, nutrition is, I remember at DOT centers, they used to give out 2 boiled eggs and 2 bananas along with the medicine, saying that at least have this. And I've heard of HIV patients, I've heard this account myself, saying that they would feel so hungry that they would eat jars of pickle because that was the only thing they had, who had TB and HIV both. Is the nutrition challenge a hidden challenge in India which nobody really looks at in TB treatment?
I think it is nutrition. One, like I said, poverty is an issue. Now, government is also, making all the efforts that it can. So every patient who goes to the government hospital, that's how we work. So we have an MOU with the government in Madhya Pradesh with the health department. So every patient who goes, what they do is unko fir 500 rupees mahine ka government deta hai, DBT as they call it, direct cash transfer. So they get 500. But Parul, the situation the speaker Amir was talking about economic challenges, and they're significant. Now these are daily wage earners, right? So 500 rupees ek mahine mein to nahi hoga, and more often than not, it is the earning member of the family, so he can't earn. Now 500 doesn't do much. So what we did was we gave them huge amount of a huge ration for the month. But we didn't give it for one person, we gave it for 5, taking a family average of 5. So you see, nutrition is a problem. One is access to it and capability to buy nutrition. But the second also important gap is the awareness of what should be eaten when. What is it that you need when you're taking TB medicine? And it's a very, very strong medication. And so the counseling that we added to it was the game changer. So, our counselors would go visit every patient twice a month to see wo khana bhi wahi kha raha hai. And I think what we have also been able to do is that we've inculcated a behavioral change in them. There are 5 things, and like now we've even made it very simple materials also, that a plate of food should have 5 colors on it. Yellow dal hai, green vegetable hai, to wo 5 color. Aise simple languages mein humne communication material bana ke behavioral change ko kiya hai. To bachon se leke till everybody in the family kind of now looks at the plate and says, hai kya 5 color? You have to make it. I think that awareness is very, very important. So yes, of course, it is very important that one, you should have the money to buy the right food, but also know what is right for you.
Absolutely. Food maps, visual food maps go a long way. Coming, thank you, Neelam. I'll circle back to all of you for a second round of questions. I'd like to go over to Shibu. Shibu, thank you. You've been extremely patient and listening to all of us talk, but thank you for joining us. I'd like to come back to you about, I have 2 questions. One is, of course, we've talked a lot about funding opportunities. I'd just like to get your opinion on the response to funding for TB with using innovative mechanisms like the bonds that Neelam mentioned. My second question is, what lessons can be derived from DOTS? I'm not sure whether it's still called the DOTS program, but from the DOTS program for overcoming vaccine hesitancy for COVID.
Yeah, so just wanted to reiterate a few points which mentioned and also draw some attention on some of the points which we have discussed so far. So every $1 invested in tuberculosis is actually in return $43. So that has been documented and researched by academic institutions and been well amplified in the TB community. So just be clear that we need more investments and then we will get more returns from it. And also on nutrition, so tuberculosis is actually an indicator of a household poverty, and we need to intervene into the household, not at the patients. So, patients certainly the government is addressing by providing direct benefit transfer, but that, as Neelam Madam mentioned, so that kind of interventions like targeting that family is the best vaccine. What best vaccine available for now in tuberculosis is actually the nutrition. So let's be clear about that. So these are going to actually pay back as dividends to us. So on the investment to tuberculosis, so we had a renewed interest in tuberculosis, especially from India perspective. If you look at the country, before 2017, that is, we have the 2017. One national strategic plan ended, and then 17 onwards, the next wave of strategic plan started, where we talked about ending tuberculosis or eliminating tuberculosis. And we see a bump in actual budget allocations and also the estimations for tuberculosis control, which is almost double from the previous year. So 1,000 crore was something standard TB funding, planning budget request for usually go for the Ministry of Finance, and now that changed to almost 2,000. And subsequent years we see actually doubling up, and it got stable because last year it was, we all know that in last couple of years it is kind of on coming down, not drastically, but again that commitment is there. So in India is from a financing standpoint of TB control program is now transitioned from an external funding support to a kind of domestic resource sustainable funding support. This is one part of the story which we know that we have planned for it, we have costed for it. Then every year we also kind of allocate money for it. So, but there are budget requested, there are the budget estimates, and then there is an approved budget. Then there is money going to the states and the consumption of the states. So there are at each level there are gaps. I'm not going into that, but again, over the years we have seen efficiency in both the sides. In what we are requested, mostly we are fetching it, and we are able to consume it also. That has been, so the efficient absorption is one of the key component of any health program. We have been always lagging behind that, and TB control program shown that is possible. And in 2020-21 we have actually overburned. So that's a good sign of that means we source money from other programs, maybe like from the NHM pool or whatever it is. So that is on the financing side. And the country also changed in the policy. Right? Some of the lessons which Madam Neela Madam also mentioned about the performance-based financing. So you know that in India, half of our patients, more than half of the patients actually go and seek care from the private sector. And 2017 onward, there is a highest thrust to the private sector. So because there were earlier to that, there were models of engaging private sector. So Government of India imbibed that lessons and then planned to invest in that. Global Fund came in to support it. But government also changed the policies to adopt in a rather than a grant in need to the NGOs to do work, they brought in performance-based financing systems. It's an output-based financing, wherein they bring in certain key indicators which actually pivoted around the quality of care in private sector. So they're targeting actually better quality for the patients who are seeking. They're targeting the behavior of the providers, doctors who they have to fall in line with certain standards which is set by the National TB Elimination Program. They also entrusted interface agencies as NGOs to run this show. So essentially an NGO will get it, and NGO know these are things which I am agreed. And if I'm underperforming, I have a downside of which is promised to us. And when I'm overperforming, I'll get an upside. So that's how it is structured. And partners like us or I work with the National TB Program to help in designing that model. So I think pretty much the principle of the impact bonds, the philosophy is the same. So we kind of, that helped us in targeting some interventions and focusing on quality thing. And there are, I'm not saying everything is hunky-dory, but there are still gaps because there is larger part of it is dependent upon the government supplies. Government supplies going from the public to the private, which need to be settled. That is streamlined in certain places, especially in urban settings, it is much more streamlined. But if you move to the peri-urban or rural settings, that has to be straightened. So I think if that comes through, and if it is an efficient implementation of this new partnership guidance, which imbibes the performance base as one of the key factor for reimbursing NGOs is something important. So if that functions well, I think we will see a better and efficient delivery. On your second program, it's DOTS by principle. So the second question. So now we don't actually focus on directly observed treatment as a larger emphasis on that. That was actually pivoted around. There is a support system for the patient and that need to be supported. Now we have a lot of digital tools and the system also changed. I would ask the overall theme of this discussion is also on the communication. How do you communicate to the patient and citizen? I would also want to bring to the notice there is something called TB Arogya Sati, which was recently launched, and then we recently had 100 or 200,000 downloads, which is a citizen and patient app, which has been, as a citizen, I can actually kind of self-screen myself. I can engage and talk with the National TB Program colleagues and get more information. I'll get connected to my, if I'm a patient, I can talk to peer patient support groups. So all sort of facilities are there. And also I can track my own adherence. If I'm a patient, I also track like how many money I got from the government. So I would say one of the key things probably this platform need to get more visibility and use channels to disseminate and amplify it. So the key lessons for DOTS, for National TB Program, experiences to leverage for the COVID responses. One thing when the COVID started, the diagnostics part of the TB and COVID pretty much actually have the same expertise we need for diagnosing. Because we know all about RT-PCR right now. So RT-PCR is a slightly specialized system of skill set is required for diagnosis. Wherein TB labs, where TB lab technicians were efficient, they're apt skill to do that. So we kind of diverted all the TB into the COVID space. And that interaction with how to manage that patients, how to actually kind of, especially on the hygiene and airborne infection control measures, which are practiced in TB program, kind of replicated in the COVID sense. And also the set of armies, and the TB program is the best program for outreach, contact tracing, and we have seen a lot of contact tracing. So there is a trained human resource available from the TB side, which got actually leveraged. Their skill set got leveraged for the COVID control thing. I haven't seen any models of directly TB staff or NTEP being, aggressively pursuing for COVID vaccination. But one thing is that National TB program and TB division actually emphasized on TB patient getting COVID vaccination. So that was something they have to get prioritized for that. In the initial days of COVID vaccination, we all actually been in the queue. So TB patients could actually jump the queue and then get the shots. As a priority. That was something which is, and also the bidirectional screening side with TB and COVID. So way before the ICMR issued the guidance of doing that. The TB program did that somewhere in August 2020 itself, like realizing that it could be an opportunity for screening for tuberculosis, and also for scientific reason of because there will be the COVID will pull down your immunity, and then that is an opportunity to break down into disease. Let's actually kind of screen that. So these are fairly the lessons. These are largely the lessons from the TB program got applied into the COVID program. I'll come back to you in the next round for much more clarification. So thank you so much.
Thank you. Thank you, Shibu. It's a really interesting discussion. At this point, I'd like to say, I'd like to invite the audience to share their questions. I'll put them in the chat box for me to. I'm sorry, I'm not allowing the chat to be open to everybody because we've had hacking challenges in the past. So just put your questions to me, and I'll then request you to ask them. While we're waiting for questions, I'd like to bring the discussion back. Rachna, thank you all of you who spoke first and have been waiting. Rachna, what are the kind of, given, you're a great believer in the power of tech and combining that with the tech and digital with business, what do you think are some of the media tools which could, or the communication channels which could possibly used for young people, for the new generation? We've spoken so much about, we've even spoken about, Neelam very clearly said that there was vaccine hesitancy among young people. Given this situation, what do you think can be done to better communicate? What kind of channels would perhaps suit them?
Sure. Thanks, Parul. And just in time question, as an organization, we are working towards its full communication program, which is focused on youth. And basis the learnings and the work that we have done so far, clearly, I think what's important is to understand and really address three critical questions, right? Who is that youth whom we are targeting? While the definition of youth is 15 to 29 years, it's still a big subset of a population which we are targeting. So who is that youth? And really not just having a segmentation, but I would say a micro segmentation of the youth. That means, which is that youth I want to target? What does he believe? What he eats? Which device he uses? How he consumes the information? What are the kind of brands they like? Where do they look at? Which are the movies? Which are the influencers they really follow? Now, is this possible? Yes. And that's where I think tech makes it more easier, because you could really get micro level information and insights to understand your cohort or segment whom you want to approach with the objective that you have in mind. That's, I think, to me, is the first step. The second step is really identifying the platforms where this youth is. So we all know today India has the highest penetration of internet in the world. We are the fastest growing social media users, and with all of this, I think 50% of the users that we see on social media today in India are in the age group of 15 to 29 years. Now that's very high. And sometimes there's a debate to say, do people consume social media for entertainment, or they even consume for serious information? The answer is they consume for everything. Today, social media, and hence it's important to keep that element that if we have to target youth, we have to be there where they are, whether in the online world or offline world. And hence, we can't miss out on digital and social media as a part of our communication strategy. And third and the last is, how do you communicate to youth? The messaging can't be the same what we use uniformly across. We really know from our research that messaging can't be preachy. We all know we can't preach our children today. We have been preached, but we can't be preached to our children today, right? It needs to be very sticky. We all have, our attention span has come down drastically, and for youth, it's quick. It's almost at a microsecond level as they toggle around on Instagram and Facebooks, right? So how strong sticky messages which resonates with youth from what they do? Let's say if they love music, they love art, they love sports, how can you resonate your messaging around that? I think it's the core of the communication strategy that needs to target youth. And last but not the least, I think to me today, digital makes things, if we use what we call in the world of digital is precision marketing, which essentially means targeting the right person at the right time with the right message. This is what we could do with deploying the right digital tools at the right platforms. And that's what we should leverage, because it makes your whole approach very measurable, at the same time iterative. So you could quickly fail, quickly learn, and scale it up. And that's the power that again digital helps you to bring. So I would summarize that's the approach we take when we move to any strategy which is focusing on youth.
Thank you, Rachna. I think sticky content, don't take it for granted that they would not respond as some of the challenges and some of the solutions that you have suggested. One final question for Neelam and Vaisakhi, then I'll throw it open to questions. I'm conscious that we almost 90 minutes we've just spent talking. So Neelam, my next question for you is that we've talked about, you of course already talked about the on-ground example of how you're using financial instruments. And for both Vaisakhi and Neelam, I'd just like to ask them that flowing from what Rachna said, what kind of media tools do you think can be used? And flowing also from what Shibu said, that the TB Arogya function needs to be people need to be made aware of that.
You want to go first?
Vaisakhi, would you like to go first?
Yeah, I can go first. So, as I said, we have been, working, helping the government with a lot of mass media campaigns and traditional mass media campaigns. As you know, there are studies around its impact, reach, and there are studies about its return on investment. But as Rachna rightly put it, digital has suddenly seen a spike, especially during COVID. So what we are trying to do also is to amplify the mass media campaigns that are implemented by the government on the digital channels as well. And where we have results from post-campaign evaluations for a certain type of campaigns on traditional mass media channels, and then we have some matrix from the digital, and that kind of does the amplification effect. So that's one thing. And the philosophy or the behavioral science that we operate on is that that awareness is the key. It starts with awareness, but it's not sufficient, and there's an entire step towards there are different steps towards behavioral science, awareness to having that knowledge build up, and then people accepting a kind of a risk behavior change, and then finally it should come to a level where people are supporting certain policies and then advocating for those policies, which in turn lead to social and behavior change and in the prevention. So this is the way we deal with and using, of course, mass media campaigns. And the key thing that we always work with the government is to, as we were talking about investments, to strengthen the government investments into these campaigns based on the return on investment that I'm talking about. And we have been able to do that through tobacco control programs and through the National Health Mission, and then some other innovative ways of investments. And we kind of are suggesting to governments the various cost efficient ways of utilizing these budgets. So first of all, it is important, as I said, to integrate some of these programs, because clearly we have a link with these programs, and integrating the budgets. And secondly, using certain legislation. So within the tobacco control laws, there is a film rule law which allows us to implement 30 seconds public service announcements on cinemas, and that's mandatory for films. So these are the legislation that we are using for free donated airtime for the government. And then we have been, as I said, we have been now focusing on also TB tobacco campaigns. And in the past years, we have implemented, so there was a mass media campaign called TB Cough, which positioned India as the first country to ever air a national mass media campaign, which showed the link between TB and tobacco. Those kind of things have been done, and we are working on those. And then there are some white papers which we have published for public education. Because we as I was talking about evidence-based communication strategies, we do a lot of message testing studies, and then promote those message for civil society and for the government to learn on how to have those kind of messages. So this is something which I'm talking about from the consumer side, when we are talking about consumer. And the other side of prevention is basically to strengthen the policies to reduce the accessibility and affordability of tobacco products, and then hence also dealing with TB control and tobacco control. So there are so many policies that we need to strengthen and have been working on, like larger graphic health warnings and smoke-free places, etc. And especially in the recent times, all the surrogate advertising that happens, because these all lead to a risk behavior, which is tobacco use, and then finally impact other public health programs and treatment outcomes like tuberculosis and COVID. So
Jackie,
this is,
I just sorry to interrupt you for a second. We talked about donated airtime of 30 seconds, but of course now cinema halls have opened. Do OTT channels also offer you that option? Is that something you could take advantage of?
Yeah, that's a great question, and that is something Parul, which is kind of right now really controversial, because see, when the Cigarette and Other Tobacco Products Act came in 2003, so there and then in 2012 the film rule law was enacted. So within the ambit of the film rule, there were cinema theaters, regional as well as or Hindi English movies, as well as TV programs. So the implementation of film rules was being done on these, but clearly in the recent times it has been seen that since the law doesn't permit the OTT platforms don't clearly come under this ambit, so there are certain loopholes which are being utilized on OTT platforms, and they are not following. And a lot of tobacco scenes are being shown on OTT platforms. And in fact, that is a recommendation which the Ministry of Health is working on, amending few laws to bring in OTT and online digital platforms also within the ambit of film rule.
Thank you. I'm going to throw it open for questions. Neelam, I'll come back to you. Probably some of the questions are addressed to you as well. Excuse me. Prachi, would you like to ask the question yourself? You can unmute yourself. Okay, I'll just read the question out for, there's a question from Prachi for the panel. Please tell us how social media is being used to target youth towards tobacco use? I think some of it you already mentioned. I think, Prachi, do you want to say to prevent tobacco use? Probably you want to say that, not to use tobacco. So does anybody have a point of view? Vishakhi, perhaps you have a point of view.
Yeah, I think social media, we are experimenting and we are now using a lot of digital platforms. But, I think answering to Prachi's question, we have actually recently launched a dashboard, which is called TERM. It is, the full form is Tobacco Enforcement and Reporting Movement. So this is basically a dashboard which monitors and tracks the tobacco marketing instances on online platforms, on the digital platforms, which include Facebook, Instagram, social media pages, as well as online portals, news portals, etc. And what we are doing is, through this tracking, we are analyzing the data and we are reporting these marketing instances to the government and civil society organizations, which are trying to strengthen the marketing restrictions and ban of tobacco to youngsters. And as we know that youngsters are mostly the audience on social media, so we have seen that a lot of offline promotion of tobacco products has now shifted to online platforms, and we are trying to create awareness around it and also help policy promotion around it.
Thank you. I have another question, and maybe Neelam would like to take that, and even Rachna or anybody else. The question is that when it comes to public health issues such as TB, from a media and press perspective, communicators often face difficulties when you're communicating public health priorities, which are being done by a brand or a pharma firm or something like that, I guess, is what they have in mind. And it can be sometimes overshadowed by what the brand reputation is, or role is, perception is. So how do you fight this kind of communication challenge, where it's not just public health, but brand plus public health? Neelam, would you like to take that up, or?
Yeah, I can make an effort, but I'll also want to add a bit to the previous question that you were asking.
Sure.
So let me first do that one. So what I heard from Rachna and Vishakhi on, how do you communicate and what social media platforms, etc. you use, and it could be on the your question from the audience. You see, again, those answers were very much focusing on the urban youth. Child Fund works with very, 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 very rural, remotest young people. So there, the communication channel, whether you see, brands don't really matter there so much. So you have to, your narrative has to be clear, your content has to be clear, and what needs to be used as tools is what will work. So for example, in villages, we use community radios. You see, we do theaters, we do plays. We do a lot of mobile vans that go around. So when we have the COVID hesitancy, we have, through our communication channel, we saw the results and output. We now have COVID-free villages in areas where we work, which means every adult got vaccinated and the hesitancies were. So I think we need to first look at who the audience is, and therefore devise your messaging, but also use channels and tools that are going to be effective and will work. And obviously, like we always say, at the end of the day, we are not the government. The government is the only one who can scale it and reach to the last mile. Therefore, everything Child Fund does is in line with the government, the whole system that the government has in place, the mechanisms that are there, and therefore leave sustainability behind. Now, when there is a brand involved in this case, again, you see, we have to be very clear that the messaging takes priority, not the brand. And that's where we actually lose the authenticity of the messaging if the brand overtakes and subsedes the message that you want to give. So I think if we are doing what we do in good faith to see the change, then we need to all come together and say, ultimately, what is it we want to achieve from here? And if we are clear about what we really want to achieve, I think brands will have to take the back step. They cannot be bigger, and Parul, this is very common. When I started in this sector and we used to do events and all. So the concept of the event, जो event का spirit होता था, वो ही lose हो जाता था, क्योंकि सारी जगह corporate का ही लगा होता था, और event किस बात की है वो पता ही नहीं चलता था कि हो क्यों रहा है, So I think as non-profit sector, especially, we have to stand up for what is right. I'm here for a purpose and I need to achieve that purpose. You are a facilitator as a brand. And so we need to give it the space and the respect. But you cannot overtake the message or the whole principle or the purpose of it. So I think that is where, as agencies, we need to be sure, why are we doing this? And what is more important in this whole picture? That needs to be there. ये बहुत सालों से चल रहा है. Brand, corporate brand is bigger than the whole event.
Thank you, Neelam. But before I take this question to Shibu, I just would like to say that India has some of the most strictest rules about communication. We have very, very strict laws and rules about what you can communicate, what you can sponsor, what you can't sponsor, perhaps almost draconian, some would say. So given that, I think mostly India has done a great job, and I think brands also very conscious of that. And I think that they are very responsible about these things. So just wanted to add that the laws are very strict in our country. So I have frankly never seen an issue where the brand has been bigger than the message. But having said that, I'd like to bring in Shibu for his views on this topic.
Okay. Parul, I need to go. I have another call at 5. Sure. So thank you. And it was delight to be part of your discussions and the panel. Have a lovely evening, all of you.
Thank you, Neelam. Thank you for joining us.
Thank you.
And to the audience, I'm conscious that we've been here 90 minutes. Thank you for supporting. And just last 1 or 2 questions before we wind up. Over to you, Shibu.
Globally also TB control program have a partnership plan and also strategy wherein all the pharma industries, and also Rachna also represent from the Janssen side, they are a critical partner for TB control program, not from the perspective of they are actually contributing from the medicines, but also a larger responsibility to kind of contribute to the cause of elimination. And this is not only for one pharma company. There is an agglomeration of many partners, and including diagnostic partners, and everyone is there. So the culture of the TB control program is more of collaborative, and it has been inculcated globally by systems and establishment, and Government of India also follows that. And we have pharma supported, corporate supported. In fact, actually, the union is the largest, one of the largest entity. They facilitate and work with the Government of India's NTEP to have corporate pledges, and under that scheme, corporates can sign off for different ways of contributing to the TB control program. They can actually adopt villages, they can actually provide nutrition. There's a different ways. And recently, I was also part of conversations from Adani Group coming in for supporting. So I think this is beyond brand. And again, I don't think that Janssen is selling their brand to this thing on their own. I don't see any reason for them to do that, rather than actually focusing on their R&D for newer, better medicines, because this is a very niche market, and there is no space for actually sales over here, I would say. So it is more than that. So we need to appreciate, and then doors need not be shut because of the worry of the brand getting more visibility. So I would say this is a collaborative effort, and we need all brains. We need more investments as kind and kind of thought leadership or examples. So we need to encourage that. Thank you.
Thank you. I think with that we'll conclude. I mean, if I'm not mistaken, some of the mining PSUs and Tata have some of the biggest TB detection and support programs. So if we were to cut out the corporate sector, I think it would really not be a PPP happening at all. Having said that, if any of you have a final question, you can always drop it in the chat box or email us later. But I'd like to thank each and every one of our participants here today who've taken the time to attend this, and also to our speakers, Vaishakhi, Rachna, Shibu, Neelam, who had to drop out, Amir also, who had to drop out earlier, and also Dr. Joshi, who joined us via video. Thank you all of you for taking the time to discuss this very important subject. Before I hand over to Chandra, I'd also like to thank Team Avian WE. I don't think I've ever conducted a podcast which I've enjoyed more and felt that we are actually perhaps making a difference. So thank you, Chandra and Shamishta and the entire Avian WE team for helping put this together. Wouldn't have been possible without you and my colleagues at PR Moment, Soumya and Heth, who have really helped work behind the scenes in making sure the invites go out on time. With that, over to Chandra for the concluding remarks.
Thanks, Parul, and thanks to all the panelists and the speakers today. This was a rich discussion, so many insights we got from different speakers, and just quickly summing up. So I think the first top key messages came from the DDG of the Central TB Division, who started off with a keynote, and he did speak about India's commitment to towards the end TB goals, and the fact that there is a close link between TB and tobacco use, which just cannot be ignored, and we need focused approaches on both programs for maximum impact. I think the DDG also highlighted that we also have to address TB-associated stigma with the help of all stakeholders and partners. And the public needs to know that there are sound treatment approaches which are effective today and which are available to patients. We also had some very important messages from Mr. L.M. Singh from Vital Strategies. I think he spoke about the clear interlinkages between TB and tobacco use again, since Vital Strategies focuses so much on these issues. He did highlight that we need help. This is an interconnected world, and people need to work together. He highlighted the very important aspect of innovative financing mechanisms that can attract resources and bring in financial efficiency in the health sector. I think this is a very important point that he made. And of course, he did say that we have a lot to learn, a lot of valuable lessons from COVID, that we should not underestimate the socioeconomic impact of diseases such as TB, and we need to address these determinants on priority basis. I think this was a very important message. From Dr. Rachna, we had some important points like, any communication which integrates the points of insights, nuanced messaging, rapid diffusion of knowledge, leading to behavior change. I think these are the benefits of horizontal messaging. Again, Rachna also spoke about COVID lessons being so valuable and digital technology giving that fillip to amplify public health messages. And since social media is used by all of us and also the youth, why not use it for larger targeted, youth-oriented messaging? I think this is very important for all of us working in the health space. Vaishakhi Malik from Vital Strategies, again, she also spoke about the close linkages between TB and tobacco, which is, which just cannot be ignored. And we need to, integrate the National Tobacco Control Program as well as the NTEP to, achieve our end TB goals. She also spoke about how Vital supports government programs through PSAs and, policy support, technical support through evidence-based messaging tests, and a lot of other support that is given to drive home the message of larger public health. She also highlighted that while awareness is key, we just cannot do just with awareness, but a lot more needs to be done. And towards behavioral change, we need to support policies, we need greater enforcement, we also need greater monitoring and surveillance mechanisms, and also integrating program budgets for greater return on investments. I think she also highlighted that when the film rules came in, Vital had an important role to play. And right now, the same is important to bring in OTT platforms also into this important ambit of, warning messages when, scenes depicting tobacco use are shown in films. Amirullah Khan, I think, highlighted the very important economic aspects and the impact of livelihoods and economy of diseases. And he made that point that it's critical to look at diseases vis-a-vis their impact, because they give us very clear, measurable targets and help us to plan next steps. He also stated that economic impact and numbers suggest an urgency. We realize a big cost-benefit analysis, and I can accordingly plan programs better. I think those are very important points. Neelam Makhijani from Child Fund, She highlighted that we have, COVID has shown us that we have more resilience in our systems. And as organizations, children are really important for us as well as vulnerable communities. We should focus on children becoming more aware, becoming stronger and more resilient amid the lessons learned during COVID. She also spoke on innovative financing, that it's a step forward for civil society and NGOs to garner resources and also have a robust operating mechanism as well as greater accountability. And as NGOs in disease spaces such as TB, we should be able to drive change and show that change, and this is so important. Dr. Shibu Vijayan from PARC, I think we also had a lot to learn from what he said on the panel today, that TB is an indicator of household poverty, and we need targeted interventions, not just for patients, but also families. And we need to look at resources and funding very differently today. He also mentioned that compared to the last few decades, we are seeing greater efficiency of resource, both mobilization and utilization, which is a very critical point because many times funding is garnered but not effectively used. And I think he did say that there are key lessons from DOTS, from COVID response, where diagnosis can be strengthened, how bi-directional screening facilities via new guidelines have come in. So all these are important today. So I think this was a sum up of what the main speakers spoke about. Thank you very much, Parul.
Thank you, Chandra. So goodbye, all of you. Thank you for joining us. Stay safe, stay healthy, and have a great week. Bye-bye.
Thank you.
Thank you.
Thank you to everyone. Bye-bye.
Bye.